More and more, we're seeing people below the age of 55 suffer heart attacks. And here in the United States, 1 in 5 people who has a heart attack below the age of 55 are actually below the age of 40 or younger. Heart attacks can be seen in patients in their late 20s and their early 30s. Is there anything we can do to protect ourselves? Heart disease is on the rise globally, and alarmingly, in the United States, this rise is seen more so among patients who are considered young, below the age of 55. Every year, the incidence of heart disease and heart attacks among these patients, this particular group of patients, is rising by 2%. Now, let us examine this phenomenon, but first, let's take a look at the definition of a heart attack. What is a heart attack? A heart attack occurs when the blood flow to the muscle of the heart is stopped, it's cut off. And this can be the result of multiple mechanisms. The most frequent cause of a heart attack is the build-up of material on the interior surface of the artery, known as the lumen of the artery feeding the heart, that causes a partial narrowing or blockage in the artery. And if this material, known as plaque, ruptures, breaks off, it can then cause the formation of a blood clot in the artery that essentially blocks the artery and damages the heart muscle. This buildup of material in the artery that leads to plaque formation is known as atherosclerosis, and rupture of atherosclerotic plaque is the most frequent cause of heart attacks in elderly patients. It is also the most frequent cause of heart attacks in this group of younger patients that we're discussing today. But although plaque rupture is the most frequent cause of heart attacks in younger patients, it only occurs in 60 to 65% of patients below the age of 55. In the rest of heart attacks, other mechanisms cause the blockage of the arteries and damage to the heart muscle. One such mechanism could be just simply the build up of plaque in the artery without the actual rupture of the plaque, leading to narrowing of the artery and a thrombus formation, the formation of a blood clot. Another mechanism that may cause a heart attack is SCAD, or spontaneous coronary artery dissection, which is a disruption of the wall of the artery that causes a partial blockage and clot formation and a heart attack, damage to the heart muscle. Patients in the younger group of patients may also frequently suffer what is known as a spasm, arterial spasm, and this can narrow the artery and cut off the blood flow, choke blood flow to the heart muscle, damaging it. Another mechanism that may cause a heart attack is what is known as coronary embolism. If a patient has a process that causes clots to form in remote areas of the body or in other parts of the heart, for instance, in atrial fibrillation, these clots can then be thrown into the circulation and travel to the coronary arteries where they cause a blockage. Finally, patients who are drug users and use cocaine or amphetamines or marijuana can suffer damage to the arteries, constriction of the arteries that can cause a heart attack. Because of the differences in the mechanisms that lead to heart attack in these two groups, the risk factors also differ somewhat. And in older patients, and in the 60 to 65% of younger patients who suffer plaque rupture as the underlying cause of their heart attack, the traditional risk factors apply, such as hypertension and diabetes and high cholesterol and lack of exercise and poor diet. In younger patients, however, the more frequent risk factors that we find are smoking and alcohol use and drug use and psychological stress, such as depression or anxiety. Among women, we find diabetes and depression and low socioeconomic status that causes stress. These factors are more common in young women. And as a caveat, a heart attack, an acute heart attack in a young woman, carries a worse prognosis than in a young man. So now that you know what the mechanisms of heart attack are and what the risk factors of a heart attack are, what can you do to prevent a heart attack? Well, the first thing you can do is, if you smoke, stop smoking. If you drink, drink only in moderation. If you use drugs, stop using drugs. It is also important to have a healthy diet. And by a healthy diet, I mean a low cholesterol, low fat, low sugar diet with at least 3 servings of vegetables and 2 servings of fruit every day. You also need to exercise regularly, and it is recommended that you should have 150 minutes of moderate exercise on a weekly basis. You also want to know your numbers. You need to know what your blood pressure is. Blood pressure should be below 120/80 to be normal. And you need to know what your cholesterol level is. Keep your cholesterol, total cholesterol, below 200 and the LDL below 130. The HDL, or the good cholesterol, should be above 40 if you're a man and above 50 if you're a woman. If you are diabetic, your hemoglobin A1C, or your A1C, should be below 7. You should try to maintain it below 7. A normal A1C is up to 5.7, and in A1C between 5.7 and 6.4 is considered pre-diabetic. A1C above 6.5 is diabetic. You should also control your body weight. An ideal body weight is a BMI below 25, and the range runs from 18.4 to 25 for a normal BMI. Above 25, you're considered overweight. 25 to 30 is overweight, and above 30 would be considered obese. You also need to control stressors in your life, and stress is recognized as a risk factor for heart disease and heart attacks, so that you may, for instance, practice yoga or practice meditation to decrease stress in your life. Finally, we need to know what the signs and symptoms of a heart attack are. The cardinal sign of a heart attack is chest pain, and patients describe it as feeling like an elephant is sitting on their chest. And this pain can radiate into the arm, it may radiate into the jaw, into the neck, into the back. It may appear in the epigastric area. Patients may have shortness of breath, or they may have sweating, profuse sweating, or they may just feel fatigue and weakness, or may suddenly develop edema, swelling of the ankles. You should remember that up to 69% of patients below the age of 55 who suffer a heart attack never have pain. Thank you for watching. If you found this video useful, share it with your friends and family, leave your comments in the section below, and support the channel by subscribing. Until the next video, stay healthy and stay safe.